Okay, so today we'll be doing our adductor wrap technique here on our midfielder for soccer. So before we're going to wrap her, we've done our horse piss assessment on the sideline or in the clinic, and we've determined that she has we suspect that she has a adductor or groin strain from playing. So this wrap is supposed to add compression and add support for an adductor and or groin strain. So before we use the wrap, we're going to do a few things. So we're going to ask the athlete if she's ever been taped before and if she's allergic to any tapes or sprays, in which she says no. We're going to make sure she's in a staggered stance. The heel is slightly elevated. The affected leg or hip is slightly internally rotated. Move that up to this and then slightly internally rotate, and the knee is slightly flexed. Can you back that back like that for me? Okay. She's going to use the couch or she could use a chair to keep her balance. So before we start, is it okay if I touch you?
Yep.
Okay, perfect. And then we're going to test for PMS. So check for tap refill. We can do that on the lower leg. Good. And then we're going to get test sensation. Can you feel that? And motor, can you wiggle the toes? Okay, perfect. So in this case, we're not going to use spray over top of the compression pants. So this would go under her uniform, so she'd have her soccer shorts over this. So we're just going to use some tape, and we're going to make it so it's double-sided. We're just going to put 2 strips to hold so the tensor doesn't move up and down on the clothing. It stays in place and it does its job. So we got our 2 strips there of our double-sided tape. So now we're going to use our double length 6-inch tensor, working from lateral to medial, trying to resist against that abducted motion and support the adductors or the groin. So we're going to start, we're going from lateral to medial. That's not good. How do we stick our anchors here? Alright, so now we're going to work lateral to medial over top of our anchors. Trying to avoid the back of the knee and add a little bit of tension. And we're going to use our dog ear technique on the first one. So make sure that tensor, just to help that tensor stay in place. And one more strip around. Just going to make sure those hips stay square the entire time, facing me. And we're going to work upwards from here. Make sure we're going over top of the iliac crest. That's going to help so the tensor doesn't slide down when she goes back into play. So just feeling for that iliac crest right there. And make sure it doesn't go over top of the shirt. And keeping our distance with the player, not invading their personal space at all. And we're going to go around again. Pulling a little bit of tension there. And since we don't have enough tensor to go all the way back around again, we're just going to finish off by wrapping the tensor around. And we don't want to finish inside the leg, so we can just fold it like this. And we're going to secure it with our ultralight. So can you hold that for me? Thank you. So we got our ultralight here. Okay, that's good, I got it. And we're going to secure this around the leg 2 to 4 times. And making sure the hips are staying square towards me the entire time. And we don't want to finish on the inside of the thigh because that's going to rub whenever she goes back into play and it'll eventually just fall off, which is no good. And then we're going to secure our ultralight with the zinc tape. And we got our second zinc tape there, securing our ultralight. Again, it's over top of the iliac crest, which is good. We're not impeding the area just below the ASIS too much. So I'm going to get you to step off the block, and then I'm going to get you to abduct your leg, so bring your leg away from you. Does it feel like it's bringing you back in at all?
Yeah.
Okay, good. So just before we get to do our sport-specific testing, we're going to recheck for PMS. So cap refill. Can you feel that? Okay, and wheel your toes for me. Okay, perfect. So now that we've rechecked PMS and she feels that it's helping her not go into too much of adduction, and it's giving her compression and comfort on those adductor muscles, we can do sport-specific testing. So we would get her to do some lateral and shuffling. Since she's a midfielder, she does a lot of kicking, so we'd get her to do some kicking, kicking back and forth, some running high knees, and if all that's good, her strength and her range of motion was good in our hospice assessment, so she can go back into play, she can put her shorts on over top, and she'd be good to go back into play like this.